Welcome to this Microlearning session by Nursing Education Network. This session is all around reflective practice. So key learning outcomes for this overview of reflective practice, and these are from the perspective for the nurse educator. So look at some of the key concepts in reflection. The adult learning principles of experiential learning, some approaches to encourage reflective practice, and also a precautionary aspect of potentially overutilizing or the limits of reflecting practice, and some key learning resources to delve further into this topic. So let's get into the adult education component and experiential learning. So really, this is learning on the job. We've developed through our undergraduate and then in our postgraduate training and our clinical experience in taking learning from our experiences, the hands-on potential learning, the situations, and as we develop and take meaning and build from our knowledge and clinical training. So as I say there, the learning is best conceived as a process, not just in terms of outcomes. So this is learning from the personal aspects and developing ourselves in a professional sense. And through the education component, we need to create an environment where we can challenge situations, challenge knowledge and skills, and support to develop, recognizing past experience and knowledge. And part of this becomes of this workplace environment and adult learning or lifelong learning cycle. So Kolb and Sean's this reflection, this experiential learning aspects, and you'll hear the terms this reflection in action, reflection on action. So sometimes it's best to what happens at the time, that unique event, and other times this reflection on action is looking back retrospectively at a practice and seeing if our emotions or our view of that would change. And it's also to be recognized that what one person can experience from a situation, whether clinical or in training, such as in simulation, that experience can be very different for another person. So we really have to be individualized and recognize the different take-home messages and development that can occur through our education and support. Now let's have a look at some of the reflective tools as we can develop in our education programs for the nurse educator. Probably one of the most common aspects of reflection in healthcare is around critical incident reflection. So learning from high stakes, high stress, big cognitive and psychological potential impacts from an individual and for the team. Now, we need to be aware that what one person can take from one event is entirely different to the other person. So we need to recognize that these are individual reflective processes and experiences from that individual. Now, the other aspects of using, say, critical incident reflection is that if we utilize reflection every time, we might miss other important aspects. The learner writes down a message or reflection that they think the educator, the assessor wants to hear, but we miss other aspects of power, communication, hierarchy, other events that really could occur in a dynamic workplace such as healthcare, and we lose the power of these other reflections because of the excitement of the cloud blue or conflict scenario. So we can take meaning and understanding found in every workday activities. So we have to be careful that reflection just doesn't become a prescribed process and a mundane. We want it to develop and enhance our professional journeys. So some of the approaches, there are some reflective tools for nursing, Gibbs and Johns. The references are on the final slide you'll find for further investigation and development. but we can utilize our feedback processes to enhance that reflective approach, utilizing e-portfolios or professional accounts to keep a record of our learning and development. And this can feed into journals, whether written or using use of imagery for some people as well, may be more effective. And all these come into the future planning and support and ongoing development of ourselves as professionals. So this was a very quick snapshot into some of the reflective tools and processes linked to that experiential learning. These are references to delve further and deeper into reflective practices. Thank you. Please visit Nursing Education Network blog for more nursing and healthcare education theory.